My name is Dr Davidzo Muringo-Shumba. I'm a paediatric cardiologist and I'm based in Bulawayo, working mostly at MPILO Central Hospital, but also part of the National University of Science and Technology as we teach our juniors, helping them to get the skills of being a good doctor.
So when did you start PhD?
Okay, so if I can go a step backwards, I completed my training in pediatric cardiology in July last year, and then I managed to finally move back home in September last year.
Was the department functional before you came here, or it opened when you came here?
So the department was functional because there were patients with cardiac conditions were being seen, and there was also echocardiology services that were around. So my coming here is to help to establish the department more in terms of improving, or rather to diagnose more patients with cardiac conditions. And my main task, or my main plan, is to be able to do something about the cardiac conditions, because at the moment we're able to diagnose them, but we're not able to do any interventions. And at the end of the day, the parent will have to find some help to be able to get their child have some interventions, can be cardiac or percutaneous interventions, which have to be done outside Zimbabwe, because at the moment we are not able to offer any interventional services for our patients. So I'd say my main task is to try and establish those services so that our patients can be helped locally, which is more affordable and more comfortable for our patients.
Okay. So what's the problem? Like, why is it that you cannot do those surgeries here at MPILO or in Zimbabwe?
Okay, so at the moment we do not have the cardiac theatre. So with cardiac conditions, you need a special kind of theatre called the cardiac theatre, and then you need the personnel to be able to function in that theatre. So some of the personnel are available, but without a theatre, we're not able to do anything. So I would say there are two ways in which cardiac conditions can be managed. There's where they open the chest, what we call open heart surgery, and then there's where we do what we call minimum invasive, because we go through the blood vessels, which we call percutaneous procedures, which are done in cardiac catheterization, which is what we mainly work on. So the aim is to establish those two main services so that they are available. At the moment, there is no theatre that's available for that.
So what do you think needs to be done to make sure that the unit is functional fully?
Okay.
The theatre.
Okay, so we can look at it in, say, two main ways. So first is the infrastructure that needs to be in place. So we need the theatre to be available, a place to be identified where the theatre can be built for the open heart surgery, which is done by cardiothoracic surgeons, and then the other theatre, which is called the cardiac catheterization lab, where we as cardiologists are able to do interventions. So we need the infrastructure to be in place. So in terms of the infrastructure, we need the permanent infrastructure, and then we've got consumables which are used by patients, so those need to be available as well. And then on the other side, we need the staff to be able to do it. At the moment in the country, it's just me and Dr. Bannerman. We're only two pediatric cardiologists in the country. So this service would need more people, more personnel, pediatric cardiologists to be able to run it. There are also other specialties that we need that are not yet available in the country, like cardiac technologies and cardiac trained nurses to be able to make the unit functional. So it's two main things. We need the infrastructure and the consumables, and then we need the personnel.